Good morning. I'm Margaret Sims, your KRTA State Co-Chair for Health and Insurance. I want to start out by reminding all of our members who have not had their COVID shots to please do so as soon as possible. Then take a picture of your COVID card on your phone so you'll have it readily available if someone should ask you. If you've had your COVID shots, you should consider taking the booster shot. This booster can be taken 8 months after the date of your second shot. Have your actual COVID vaccine card with you when you go to get the booster so it can be updated. Then retake the picture of your COVID card on your cell phone so you'll have it available. All of us need to think about our own safety and the safety of the people around us. Now, I want to talk to you about some items of interest regarding our insurance. For those in the under 65 category, you're on the KEHP, the Kentucky Employees Health Plan. It's financed by the state. It's the same plan as your active teachers. You will have coverage this coming year. Now, for the over 65s, if you have not had your wellness visit done this year, please get it done soon. A couple of weeks ago, United Healthcare extended the deadline to September 30. Hopefully, you will have had your wellness visit and have called Renew at 888-219-4602 to turn in your visit so you can receive your $25 reward on a reloadable card. If you've not already had the wellness visit for this year, please get it done by September 30 and call Renew. Same number, 888-219-4602. Something that I have spoken on before is hospital admissions. If you go to a hospital, they may wish to keep you. This being said, if you are hospitalized as an inpatient, you will only pay $200 for that hospital stay, regardless of the number of days you are there, regardless of the doctors who treat you, regardless of the test performed, and regardless of the medicine you receive. The hospital stay is $200. If you need to be hospitalized more than once in a calendar year, your total obligation for each hospital stay as an inpatient is only $200. If you are an inpatient in a hospital, you may qualify for meals to be delivered to your home when you are discharged. When you're told you're going to be discharged from the hospital, please call Mom's Meals. It's 866-896-1895 and apply for the free meals to be delivered to your home. I can tell you firsthand, these meals are not only meet the guidelines for your particular diet, they taste good. Mom's Meals will explain what meals are available, and you can choose which meals you want. Now, the ones of us over 65 have the opportunity to have a nurse practitioner come to our homes for a checkup. This is a separate program from the wellness visit. This is the House Calls program, and it can be done anytime during the year. Call 866-799-5895 to schedule this visit with a nurse practitioner. If you have any problems with scheduling, such as being told there are no nurses for your area, please call me. I can help you get your visit. Then for your visit, the nurse practitioner will bring you a gift. Perform a physical check and put your info in the computer and you'll receive a $50 gift card. My suggestion has always been to get your wellness visit through United Healthcare during the first part of the year and get your gift card, and then do a house calls visit during the fall months. This way you get 2 physicals that are free to you, and then you get paid in the form of gift cards for staying on the healthy trail. We still need more of our over 65 population to get their DNA testing done by Coriell. Let's make sure that the medicines that we're taking are doing what they were designed to do to help with our medical needs. Call 888-454-9024 and request a DNA test. There is no charge for our over 65 members to participate in the DNA test. The savings are great when we only take medicines that are correct for our needs. The greatest benefit is that we're taking medicines that are designed to treat our symptoms effectively. Your DNA test is privacy protected under the HIPAA Act, and don't worry about your personal information being out there for everyone to see. After you mail in your DNA test, you'll receive a call from the RX Coalition. The licensed pharmacist will go over your medicines and the results from DNA testing to see if the drugs you are taking are what are needed for your particular case. One thing to remember, if your doctor wants to add a new medicine, I have this suggestion. It's worked for me. While you're in the doctor's office, in the room with your doctor, when they suggest a new medicine, call the RX Coalition. That's 855-218-5979 and ask for a pharmacist. Put your phone on speaker and have the three-way conversation about the new medicine before you take a prescription to the pharmacy to be filled or before your doctor enters the new prescription on the computer to have Express Scripts fill it for you. The last thing I wish to talk about is the mental well-being of our members. We need socialization. We need to be around people. We need to interact with people. Too many of our members have been home alone for too long. I ask that each of you listening to this meeting today, please call some of the members who are not on the Zoom meeting with us. Please check on our members. Just hearing another person's voice means so much to a shut-in. We have members who are suffering from depression because of the way they have been living since COVID began. We have to take care of our members. Depression has increased threefold. Depression has contributed to a great number of our members developing Alzheimer's disease, and many are suffering from dementia. I have received many calls from adult children of our members who are watching their parent or parents suffer from Alzheimer's. It's heartbreaking to hear them tell of how their parents have declined in the last year and a half. Socialization is the key. People need people. Just think of the older people you know who are suffering from this dreaded disease, Alzheimer's. There are 6 million Americans living with Alzheimer's. More and more Alzheimer patients are becoming dementia patients. Many of our members are caregivers for both Alzheimer's and dementia patients. It takes a toll on these caregivers. When I speak of the development of these dreaded illnesses, let me give you some red flags to watch out for in our older group. Starts with 1, difficulty with everyday tasks, such as keeping track of monthly bills, or difficulty following a recipe, or having trouble just finishing a task. 2, asking a question, hearing the answer, and then repeating the same question 15 minutes later. Or they tell you the same story over and over again. 3, they have difficulty in joining in a conversation, or they stop abruptly in the middle of a thought, or they struggle to think of a word or the name of an object. People with dementia have difficulty with visual and spatial abilities. This can manifest itself in problems like getting lost when driving. A member who is acting unusually anxious, confused, fearful, or suspicious, or they become easily upset, or they lose interest in activities and seem depressed, is cause for concern. Confusion is knowing where they are or how they got there. Or a person that becomes disoriented about time, such as on Friday they ask if it's Monday or Tuesday. And pay attention to a person if they have increasingly poor judgment when handling money, or if they start neglecting their grooming or their cleanliness. From age 50 on, it's not unusual to occasionally have trouble finding the right word or remembering where you put things. However, persistent difficulty with memory, cognition, and the ability to perform everyday tasks might be signs something more serious is happening to a person's brain. Dementia isn't actually a disease. It's a catch-all term for changes in the brain that cause a loss of functioning that interferes with our daily life. Dementia can diminish focus, the ability to pay attention, language skills, problem solving, and visual perception. It can also make it difficult for a person to control his or her emotions and therefore lead to personality changes. We all need to be aware of the signs of Alzheimer's or dementia among our family and among our members. Like I have said many times, don't put off until tomorrow to get things done, because you may not be here mentally tomorrow. If you ever have any questions about health and insurance, please let me know. Just email me or call me. Most of all, take care of yourself, and let's take care of our retirees. Thank you.